You're listening to Catalyst for Change, and my name is Jessica Huckabee, your host. I started this podcast to learn what makes people resilient after challenging events and how they've used those series of events as a catalyst for change in their life. You'll hear stories of resiliency and strength, so get ready, sit back, and be prepared to be inspired. Today, my guest is Joy Burkhard. She's a mental health advocate and advocate for maternal health care and mothers. Her family lost her brother to suicide, and she's been fighting within the system of health care at Cigna to improve and advocate for mental health care for all. Joy is the founder and director of 2020 Mom, a nonprofit closing the gaps in maternal and mental health care. 2020 Mom's brand and social change product portfolio includes the bluedotproject.org, which focuses on the difficulties of motherhood and reducing stigma of anxiety and depression, and most recently, momcongress.com, which brings together moms and those who support them at Washington, D.C. to hear from inspiring speakers and meet with Congress to address what matters most to moms. Thank you, Joy, for coming on my podcast, Catalyst for Change, Stories of Resiliency. I really loved hearing about your story and 2020 Mom. Can you elaborate a little bit more about what you're doing and what led you to create 2020 Mom?
Great, Jessica. Well, it's so nice to be here with you. And I love the concept of how to empower other people to be catalysts for change. I think that's what we all kind of hope for in our lives. So just want to thank you for your work and helping to bring stories to inspire other people to the table as well. So a little bit about me and what brought me to this work with 2020 Mom. I like to say that I had several circles in my life, or worlds, and I view them kind of as these circles or planets that collided. And one, and the big one really, was that I had a little brother who was 7 years younger than me, who struggled with mental health challenges really for most of his life. Like I remember when we would take him to preschool, he cried really every day, all the time. Like he didn't stop. Like most kids have a period of separation anxiety. Like he truly had real deep concerns about being alone or away from family, anxiety, likely social anxiety. And he was never really diagnosed with social anxiety, but later led to depression. We know that so often anxiety can be a precursor, right, or trigger depression. And ultimately, in his early 20s, he ended up taking his life. Mm-hmm. I was working at Cigna Healthcare at the time, an employer that I really had the good fortune to serve for almost 24 years. A healthcare company, and really felt like I had the potential to learn how to get him help when I knew he was struggling, and I couldn't figure out what I could do, even though I was in the system that was designed to serve him. Yeah. And that was really difficult, as you can imagine. And really at the same time, two other worlds, right? So my world with my brother, my career at Cigna in healthcare. I had just had my own son about 6 months actually after my brother passed away. And I had a prior experience myself with a blip of depression just after college, and luckily got well pretty quick, but knew that I was at higher risk for potentially having challenges after the birth of my son, or even during my pregnancy. We don't talk about that. Yeah. And then finally, and I actually was okay. I didn't suffer in the postpartum period because I had a lot of help from my husband. And then this fourth world was that I was doing advocacy work with an organization called the Junior League. And the Junior League, we held a contest called There Ought to Be a Law. And we invited all of our Junior League members, which is really the mission of the Junior League. Is it's really about women serving women and children. And this young junior league member submitted an idea for a law after her sister had had a baby. And she was on the plane home from visiting her sister and read this article in Glamour magazine about an Olympic athlete whose twin sister had tragically taken her baby's life and then her own.
Oh,
Now
man.
we know she suffered from postpartum psychosis.
Mm.
And she said, I think hospitals should provide information at discharge. And so that was the idea we took to the California legislature. And really one thing led to another. So all of these worlds, right, these four worlds really collided. And I was in a position, seeing that nobody else ultimately was, I was in the position to say, okay, I can start to hold some meetings here. And one thing led to another.
Oh, that's amazing. That's so it came from an idea that you had and another colleague had at the junior league. Um, is that what I'm hearing? And that kind of started the advocacy with 2020 Mom and getting legislation passed and that type of thing. Is that what
That's
I'm hearing?
right. It really did. Yeah, these worlds collided was what inspired me to raise my hand, but it was really the foundation through the junior league with this initial law, through the state policy work the junior league was doing, that opened the door to the work that has ultimately, become 2020 Mom. And I'll tell you just a little bit about what happened there. That idea for hospitals to educate women and their families when they have a baby at discharge about the signs and symptoms and local treatment options and things like that. Um, that was in 2009. And that the author, the legislator that carried that bill, said, I actually think there's a little more to it here, because probably doctors should be doing something. What's the role of insurers? What is our public health department doing here? And he, Pedro Nava, was his name. A lot of Latino men, by the way, have become such champions, because I think because there's just this deep love for their mothers and motherhood. Um, he said, I think we should form a task force. And it was at the height of the budget crisis in California. And the bill was written in a way that would a state agency like the Department of Public Health would host this multi-stakeholder task force to study maternal mental health and issue recommendations for the state. So sadly, that didn't take off in 2009, 2010.
Mm-hmm.
But instead, we that bill died. It's called the bill dies when it doesn't move forward. And
Okay.
instead, the Junior League introduced a resolution declaring the month of May, every May, Maternal Mental Health Awareness Month in California. And it was the Senate that tucked in language after hearing testimony on the other bill from mothers and fathers who lost mothers, and just really remarkable, clinicians, all these people. It was so compelling, the testimony. They said, we think volunteers should form a task force or a group to study maternal mental health in California. And so that's when I asked, who's going to do this, and tried to find a home. And really, there was nobody else. And I thought, well, I guess I can host calls and we'll see where things go. So that's how it all started.
Wow. So the bill didn't pass, even though Pedro Neva, you mentioned, worked really hard on creating that task force and getting that public health to host that. And, that didn't seem to work out in 2010. So you took it upon yourself, started this nonprofit that actually researches maternal mental health and studies it and gets people, volunteer people together that are in these key positions, it sounds like, to really research what we can do better as a society. Is that
Yeah,
that
I
is
love the way you frame that. In this space, it can kind of get complicated, and that was just real clarity around what we do. That we began to convene these multiple stakeholders first as I was just a volunteer, an individual, and I think this is nice to tell your audience, since we're really talking about catalyst for change. I didn't know or think about starting a nonprofit right away, but just I found the way to get a free phone number to, provide a call in, and we had monthly calls, and soon realized it's more than just about training providers, which a lot of people in our space, because they were mostly therapists, behavioral health therapists, the champions, right? That's who would often see these mothers that were in really dire straits by that time. And so there's always has been major champions and behavioral health providers, therapists in particular. So, it started out with just these phone calls, but we quickly learned that we needed to convene, as Pedro Nava had a vision, for multiple stakeholders in order to really understand why women aren't being diagnosed. Screened is what we say for giving a questionnaire about depression. And someday I hope, by the way, that there's a saliva test or a blood test, some sort of biomarker, we call it,
Yeah.
because I think that will reduce stigma, right? It's actually a medical, biological, something changes in your body when you become at risk for depression, anxiety, um, and or have depression and anxiety, right? There are changes in our biological makeup, and if we can measure those, then we really can reduce stigma. I digress there for just a little bit, but that screening tool right now is a questionnaire. It's not hard to administer. It takes a little time by the patient, but it's sort of the then what do I do after that? So that screening, diagnosis, and treatment, all those rates are very low in our
Mm.
space. Have they been improving over time? Yes, and mostly because the right stakeholders have been engaged. A lot of that work, I think it's safe to say, has been driven by 2020 Mom, but of course there's other champions out in the space as well. And so convening these stakeholders has really been something that we took on from the start to see, what are the real barriers here for screening, diagnosis, and treatment, and what can we do to lift up the pathway for change.
Wonderful. And I really like what you said about biomarkers. They're becoming so prevalent in the field of traumatic brain injury where I work, as well as in diagnosing depression and some of these changes that are happening in our bodies and our brains and our yeah, so that's wonderful. And I hope researchers are making more headway on the biomarker field. But that really helps, because a questionnaire, people think, oh, well, I was in a different mind frame, or they may not do they take it as seriously if it's not biological? So those are some of the questions that I would have about biomarkers and, screening, questionnaires, because those can be looked at very differently. If it's a biological thing, they can say, yes, for sure, you have this. Or if it's just a questionnaire, there's a little bit more room for error, I would think.
That's exactly it. And the stigma and shame factor really can come into play
Mm-hmm.
in how women might answer those questions.
Yeah.
And I think what you're saying too, Jessica, is like, I might not even recognize it in myself because I might think this is normal adjustment to parenthood, or I'm just stressed. And sort of culturally, there are different pressures and sort of stigmas, if you will, in different cultures. So
Yeah,
yeah,
true.
this just makes it like any other medical condition, which the brain is part of the body, right?
Yeah.
We believe like we shouldn't be carving out, chopping off, whatever, however you want to frame it, the brain
Yeah.
from the body. And I'm guessing you believe that too with your work, but
Oh,
yeah,
definitely.
this is a medical condition. We treat
Yeah.
it with behavioral health specialists.
Yep. That is so true. And thank you for putting that out there, because not all our listeners know about the biomarkers and know about the mental health. And after having a child, it's you change in many different ways. And now you mentioned that your brother had committed suicide in his 20s, and that must have been horrific. And what were you like, what do you think could have changed in the system of public health and healthcare to help your brother at that time?
Yeah, I love that. I love that question. And that's really the heart of our work. Our focus at 2020 Mom is around maternal mental health disorders like postpartum depression.
Yeah.
Um, but, and the work we're doing is around, quote unquote, integration, putting the brain back on the body,
Yeah.
making sure our medical teams are diagnosing, screening and diagnosing. That's where patients deserve to be screened and diagnosed if this is a true medical condition. And that's our argument, that these disorders should be treated no differently. It's not a one-off. You
Yeah.
shouldn't need a separate insurance plan to treat behavioral health disorders. That doesn't make sense. Would we really design it that way if we were to start over now? It shouldn't be an add-on benefit, right? This is sort of baseline work, baseline body work. Some would argue vision and dental shouldn't be carve outs and add-on benefits either. But people
Yeah.
can really understand why the brain is like the heart, and why would we carve it out? It's pretty easy to make that connection. So this real integration work, I think, is what was missing. It's been missing for all of us right now, but was missing certainly when my little brother was going through um, his struggle. And then, I also just want to put out that there's some recent work from the U.S. Government. Some of you may know the role of the U.S. Preventive Services Task Force, and that was a task force that was put together 10 years ago under the framework of the Affordable Care Act. And the Affordable Care Act, some people might remember, provides treatment, screening and preventive treatment at no charge for patients. That's the intent. Screening, it's really clear. Sometimes preventive treatment is fuzzy, like what does that really mean? And I think there still needs to be some work done through the U.S. Preventive Services Task Force to provide more clarity there. But
Yeah.
essentially, prevention should be no cost to people, which makes sense, right? To try to keep you healthy.
Yeah.
And so we think there really should be work around, so there's that lens on prevention and the value of the U.S. Preventive Services Task Force saying that screening for depression and anxiety, for example, there are so many other things, colorectal cancer, you name it. There's a position from this task force on whether it's a grade A, B, C, whatever, whether they recommend these screenings, if they're evidence-based, and if they are, then they're covered at zero cost. We think that there should be a similar entity, maybe this entity with expanded purview, that should also be developing treatment guidelines and saying that this is evidence-based treatment, not just preventive services, but evidence-based treatment. Right now, it's the Wild West in the US.
Mm.
There are recommendations that come out from trade associations. And when I say trade associations, I should say professional associations. So for physicians, for example, like the American Psychiatric Association, the American College of Obstetrics and Gynecology, the American Pediatric Association, for example, they will study research and put out guidelines, but that doesn't lead to change. It's just recommendations for providers, and it's helpful because it is the Wild West, right? At least providers have a way to look at some sort of standard of care through their trade associations if they happen to belong to one, right? Like none of this is mandatory.
Yeah.
And again, if a position is put out, it doesn't mean providers have to follow it.
Yeah.
But if a federal agency or entity, the U.S. Preventive Services Task Force is an independent entity appointed under a federal agency, AHRQ, but independent providers that sit on it. If those treatment guidelines were recommended and there was some sort of system to oversee and monitor, like there is through the Affordable Care Act to some degree for prevention, this would change everything. And so, and not unique to maternal mental health, but really is a project that I think would solve a lot of our challenges in mental health and in medical, and our medical care delivery model as well.
Yeah, no, that's so screening, prevention, really having evidence-based treatments, not just evidence-based information for prevention. That would be very helpful. And that would have been helpful in your case with your brother's struggle, it sounds like. And that's what you're working to change from the inside with your work at Cigna. And now being, full time with 2020 Mom, you're working with the legislators and the task forces and different providers to get that rolling in the right direction, it sounds like.
Yeah, that's exactly it. We're early stages, but we have floated this idea to a few other change agents in Washington D.C. So we hope to see some liftoff here in the coming months, probably more likely years, but sooner rather than later.
Wonderful. It's wonderful, all the work that you're doing, and thank you so much. Now, what would you tell other moms or people that are struggling with mental health challenges right now?
Yeah, I mean, and let's just acknowledge the time that we're in here in 2020. Who would have
Yep.
ever imagined? And it's so ironic. Our name is 2020 Mom, and it really was about this year being, the aim to have laid some significant groundwork in maternal mental health, and then to think about how we might pivot. So it's an interesting time for us. And I find it fascinating personally that our name includes this year, and it's such an interesting year
Yeah.
for mental health for so many reasons, right? So a reckoning and how we support families and those that serve families, like teachers, paid family leave, um,
Yeah.
low-income workers who have no choice but to go to work and are expected to homeschool their kids.
Oh my goodness. Yeah.
Sort of racial reckoning too, right?
Yeah.
That and we know that people of color, in particular, Black Americans, are suffering at higher rates of mental illness, including something we call dysthymia, which is sort of like a low grade, just a feeling of blah, like
Mm.
just pressure and yuckiness is kind of the way my brain thinks about it all
Yeah.
the time, right? It may not be clinical depression. It's not so severe I can't get out of bed. And that's not the Black culture anyway, especially sort of young, I mean, not young mothers, in particular, the women we serve, they are strong. They pull themselves up by their straps, even when they're struggling.
Hmm.
So it's just, let me just start by acknowledging all of that. It's been a tough year, and one that we all need to think about in terms of mental health. Um, and I guess first I want to say that now's got to be the year that mental health gets priority. And there was just a CDC report released 2 weeks ago about what these times are doing to Americans in mental health, and significantly increasing rates of depression, anxiety, of course, but even suicide, for all the reasons we can imagine that someone might be struggling. And I wonder myself if they've been able to access care.
Yeah.
Sometimes people don't even try for various reasons, but often they do, and it's not there. Um, so I guess my advice, back to your question about what should people know who are struggling right now, moms or others, is it's not an easy system, and I would find your peers. Who else is in your shoes that is struggling or has struggled in the past for similar reasons? And if anyone can't find, let me just say, a Latina, I'm a Latina woman, and I'm struggling right now because there are domestic pressures at home. We have lost an income. Like, where are my peers? How do I find them? If you don't know, like many of you know who these peers are in your community, depending on the culture. But if you don't know, we will help you find your peers. And the same goes for men. It's much harder, I think, for men to recognize a mental health challenge, and it often comes across as anger
Mm.
and just like rage and anger. And women can feel this too, but this is like just major distress, and it comes across as rage and anger, and there's
Yeah.
often an underlying anxiety, depression, something underneath it that is either building or already there. So we're happy to help people find their village of peers. That's where always say to start, and Facebook groups are there. And those peers often know how to navigate the healthcare system too, if
Yeah.
people are comfortable. Some people just don't even want to go there. And, at some point you need to, if it's moderate to severe depression in particular, don't let it get to that point, and we will help you find these villages, including 2020 Mom will help you find who to go to that will listen and understand if you can't quite figure that out by yourself, and you shouldn't have to.
Yeah.
That's not the way it works for heart care, right? Or diabetes. You don't
Yeah.
have to figure out who's there for you and who's not.
Yeah, that is so powerful that, you and your team are you can help people find their peers, their mentors, their network of, connections who are in their community that could help, either if they're a mom and they're struggling with depression after giving birth, or just with all the responsibilities of having all, children at home, or if they're men, maybe they can also reach out and you can point them in the right direction. And you mentioned Facebook groups. I know there's a lot of good Facebook groups for parents or people that are, suffering from mental health challenges or brain injury. There's a lot of really good Facebook groups out there and online support groups. And so there is help out there. We just have to know where to look. And it sounds like you're a good resource for that. And I'll have your information in our show notes for sure.
Right. And I'll just add, with the Facebook groups, our advice is to look for a group that's hosted by a nonprofit. It's not always possible, but then that there's a board of directors and trained, qualified moderators. So just that's where we often, it's not
good.
always the case. And
Yeah.
a lot of vetted mental health Facebook group leaders who we have vetted, and we know that they're really a great people to be leading the work, and they just don't happen to want to start a nonprofit.
Yeah.
But sometimes it can be overwhelming, and that's where I'd start. And if you don't mind, Jessica, I want to give a plug to one of our partners who is that village for moms who are suffering right now. 2020 Mom's really about the systems change
Mm-hmm.
and empowering mothers once they heal to become advocates to change systems and how to do it. Our partner, Postpartum Support International, is the community that is online and hosts Facebook group for mothers who are struggling now, a way to find peers. We sometimes help with the care navigation piece with insurance
Mm-hmm.
because it's so complicated, and we've got that skill set. But Postpartum Support International is the home for suffering mothers and families who want to support suffering mothers. And we like to think of ourselves as the kind of home for champions, and moms included, right? And especially moms who are ready to effectuate change once they have come out of the storm.
Really nice. That's really nice to hear. So Postpartum Support International is to help you find your peers, parents. And it doesn't have to be, postpartum doesn't have to be like you just delivered a baby in the last few weeks. It could be you have kids of any age. Is that correct?
They like to focus on pregnancy, so the name is a little misleading. I'm sure my colleagues at PSI, Postpartum Support International, will chuckle when they hear me say this, but we tease them a little bit about, can you change PSI to mean Pregnancy and Postpartum Support International? And it's a nice segue to describe we call it the perinatal period. It's pregnancy and up to 1 year postpartum. And Postpartum Support International serves both time periods. In the past, they've been around for 30 years. And in the past, there really was a focus on postpartum depression. That was the term
Yeah.
researchers used, right? Now we know it's pregnancy. We have almost as many new cases of anxiety and depression that occur during pregnancy as we do in the postpartum period. That, it just wasn't being researched in pregnancy at the time. Now we know that that's the case. And of course, there's a range of disorders. It's not just depression. They don't have depression in their name, of course, but
Yeah.
we learned that through research as well. So we're really talking about pregnancy through the first year postpartum. But I also, PSI doesn't turn anyone away when a mom feels like this is, or even someone who's experienced loss right? Like stillbirth or miscarriage, it's just tied to pregnancy in some way. Are you experiencing a challenge? And it, could be that a woman stops breastfeeding after a year, for example, and that triggers something related to mental health. We still all consider that the perinatal period, if not, clinically tied to the time frame, it's all related to pregnancy and birth, and so PSI doesn't turn anyone away. We use the term maternal mental health to kind of acknowledge the struggles sort of beyond just that 12 months often. Although I would say our core work really is around pregnancy and that first year postpartum, since so many women still fall through the cracks, our real focus is on that period.
Wonderful. Well, this has been a really great conversation, and I feel like I can talk to you for so much longer. But I want to thank you for coming on the show today, and I will have all the information you mentioned in our show notes so people have it. And thank you so much, Joy.
Absolutely, Jessica. Thanks so much for having me. It's been such a pleasure, and I look forward to hearing from some of your listeners.
You've been listening to Catalyst for Change, and my name is Jessica Huckabee, your host. Join us next week for another story of resiliency. And please subscribe wherever you listen to your podcasts, and feel free to leave me a comment or email me at catalystforchange20@gmail.com, or on Facebook, we have a page at Catalyst for Change Resiliency.